Must be a very daunting task for you to get up early in the morning the day after the exam is over. But most of you are here, so welcome and good morning. My topic is going to be not really career guidance, but where you're going to live for the next 30, 40, 50 years in life. And I'm going to talk on certain aspects of life in general for you to help you to make a decision whether Sri Lanka is an option or moving away is better. So the question is to stay or to flee. No, actually say not to stay. So the option, as already said, is for you to build a career in Sri Lanka and live in Sri Lanka, or thinking of migrating to a what we call a Western or a developed country and build a career there. There are challenges and limitations on both sides. My duty today here is not to say that you should stay or you should go. Rather, give some perspectives on both sides so that you can make a better informed decision. So, the whole purpose for most of us is to be happy. We all want to be happy in our lives. But one thing that we have to remember is happiness is multifactorial. It's not based on one particular thing. There is, as you can see, mind is involved. There are people who are always happy even despite having a lot of issues and problems. Then the home and the relationship you have with your spouse, with children, with families, brothers, sisters matters. And life in general, where you live, which city you live in, will also decide. But what we are going to talk about today is based on what you do, your professional career, and the amount of money that you are going to make out of that career. So the question arises, which is more important for happiness? Whether having more money will make you happy, or is there something more in terms of your professional job satisfaction that will help you to be more happy? It's a difficult thing to say, but we will just look at some aspects of making more money, whether they will make you more happy, and whether job satisfaction matters. So, what is job satisfaction? Is the level of contentment an employee feels with their job. So, is it more likely to be here in Sri Lanka? Will you get more satisfaction? Or will you get more satisfaction if you go abroad and work in UK, Australia, or New Zealand? Well, the difference working in Sri Lanka and abroad as a doctor is that in Sri Lanka, as a doctor, you are considered a leader. You are looked up to by the medical students, nursing staff, all categories of people, and out of hospital in the society, you will be looked up to. They will come for your advice not only for their diseases, but also on general matters because you are considered educated, you are considered more balanced, with a lot of wisdom and knowledge. Whereas in UK, you will be part of the wheel. You will be just another one of the employees. You will be considered as part of a team, but just like any other member of the team. Recently, I heard about a doctor complaining. He has worked in UK and just returned, and he was in the theater. He was waiting to put a pacemaker on a patient. There was some delay, and he was trying to make some noise. Then the porter has just put the patient on the bed and said, "I have done my job. You get on with your work." That is how the porter will address a doctor. Not always, but we can apply it. So you will be part of a team, but not as a leader. Then in Sri Lanka, you will also get some rewards like a thank you card, a cake, when you do something for the patient. And that kind of rewards are very rare to come by if you live abroad. But in the society, if you are waiting in a queue, the chances are high that somebody will recognize you and leave this place in the queue for you. That will never happen in UK or Australia. They will probably not recognize you as a doctor even. But these rewards and this satisfaction comes with responsibility. You have to dress appropriately, you have to act with humility, you have to treat patients with respect, you have to show discipline in your social media platforms. Those are very important if you want to get this job satisfaction and rewards. Then sense of initiative. If you say that someone, people say that employees who are happy are people who want to do more than what they are supposed to do. They want to do something extra. That is called sense of initiative. That is very freely available in Sri Lanka. As a consultant or even as a doctor, the amount of work that you do is decided by you most of the time, especially for the consultants. You can be a hardworking doctor working 8 to 4 every day. You can work every other day and get on with it without being punished for it. And you can work extra as much as you want. There is no limitation of work that you can do. So that kind of happiness is very difficult to get in UK or in most of the other countries because you work according to the guidelines, according to the protocols. For example, if you take a half a day catheter released, you're supposed to do 4 angiograms in that half a day, regardless of the waiting list, regardless of the time that you have, extra time that you have. You can't say, I want to do 2 more cases. That's not allowed. Here we can decide on whom we want to do, how many cases we want to do, all that. So this sense of initiative is very important for happiness, for job satisfaction, and that's cleanly available in Sri Lanka. This is the picture is one of the medical camps we organize in Legal with some of the physicians and doctors. So that kind of initiative is not possible in more developed Western countries because you will be working according to a protocol guideline. There is very little freedom for you to adjust things in terms of work. Job satisfaction also depends on workplace relationship, how you build up your relationship with other colleagues, junior staff, paramedical staff, all that. So, arranging trips like this is one of our trips the cardiology unit has to Norelia. It's almost impossible in a Western country. So, developing comradeship and interpersonal communications to work as a team is very important. And more importantly, there is less performance. This gentleman who is a doctor, he is 5 feet 10 inches tall. He has spread all the paperwork that he has to do for each patient who is admitted to the NHS. For every admission to the NHS, this is the amount of paper that you have to keep filling. I'm sure they would have switched to computer, but you still have a lot of process to click. So less paperwork. I don't know for you, but for me, paperwork is horrible. It's what takes the pressure off the work, the amount of paperwork you do. But of course, then comes the income part, the payment. In Western countries, you will generally earn more, but you have to understand there are exceptions. There are consultants in Sri Lanka with private practice, they earn sometimes 2 to 3 times the amount the doctor will earn in UK. So it's not that if you go abroad, you automatically earn more. But in general, yes, that the normal doctor in UK will earn more. But we would have come across recent news items where the doctors, junior doctors in UK were on strike recently. The reason being low pay. A bus driver in UK per hour will be paid more than a junior doctor. So if you are concerned about payment alone, maybe switching careers to being a bus driver is something that you can consider. That's true. So, but then earning extra money in Sri Lankan context means you doing private practice and spending a lot of time. So the private sector money comes with spending time which will affect your work-life balance. You will lose quality life that you should spend on leisure, exercise, and quality family time. But remember the average salary, the family income for a Sri Lankan family is about 76,000 in 2022, I think, or 21. So as a junior doctor even, you will make about double that amount of money. So you will automatically fall into the top two, three, maybe 5% of the population in terms of income. So you don't have much to complain because you will be living well above the average life of a Sri Lankan, even as a junior doctor. So will money help you to become happy? Yes, if you are very poor, if you are struggling to make 3 meals a day, if you are struggling to pay your health insurance or health expenses, if you are struggling to send your children to tuition, yes, the extra amount of money will make you happy. But beyond the particular level, suppose you are in the middle or upper middle class, extra money is unlike to make you more happy. You would have come across a list of people who are billionaires who have committed suicide. So it's not the money. They talk about what is called the hedonic sentiment. Then when you have a lot of money, you want to have the next thing, maybe a swimming pool at home. But once you get a swimming pool at home, you are happy for a few months. But after that, you start thinking about the other goal. So it goes on like that. There is no end to it. You keep comparing with other people and trying to get more and more. So you have to find what you want in life. After grade 5 scholarship, you would have seen the top people who perform well are interviewed in the media, they are on the social media, newspapers, TVs. And what do they say? I want to be a doctor. I want to serve the people of the community. I'm not interested in making money. What do they say after O-levels? It is the same. And even after A-levels, still, most people would say that, though the trend is slightly changing. But once they pass out from the MBBS, they have lost focus. They have been sidetracked. By who? By the society, by the faculty, university, lecturers, or is it the lack of role model? I don't know. So there is something that happens during the medical faculty, which sort of makes you lose your focus. Your good aims are all lost, and suddenly you become very self-centered. Whether it is the right thing to do, do we have a responsibility towards the society? Is the other thing that we have to ask. Is it that pay that right for you? Because it's not free education. The education that you have had is public funded, which means every Mendes, Andasami, and Mohammed has paid for your education. In UK, they will say every Tom, Dick, and Harry. So everybody, either directly or by indirectly, have paid for your education. Your education is paid by the tax that they get. The tax can be direct tax, people who are paying tax, or indirect tax. Every pound of sugar, every gallon of petrol that we use is taxed. And that money is used for your education. It's not only that, every patient that you have taken a history, examined till their tummy have done that, hoping that one day you will become a doctor and do something good to the society. So we have a responsibility towards the society that has helped us to study medicine. On average, if you are doing medicine in UK, Australia, or America, you will be paying a lot of tuition fees. And by the time you pass out, you will be in debt in hundreds and thousands of dollars, no pounds. And they keep paying that money for over 5 to 10 years. So what is the scope? Scope is opportunity for action and thought, which is plentiful in Sri Lanka. But as I said, there are limitations. What are the factors that account for happiness? If you say GDP is matters, which is very low in Sri Lanka. Social support, if you are worried about when you are 80, will there be somebody to help you to find health support, accommodation? No, that kind of support is not there in Sri Lanka. Life expectancy is reasonably good. social freedom is there, but not social media freedom. We have been talked of that recently. Generosity, not much. Absence of corruption, I don't have to comment. But if you want to be happy, you should be migrate into countries which have been found to be the happiest countries in the world, which are Finland, Denmark, Norway, Iceland, and others. Anyone planning to go there? Any of these countries? No. So we are not going after happiness, right? Then the question comes: what is meaningful life versus happy life? Whether you want to have a happy life in terms of self happiness, or you want to have a meaningful life which will have purpose and significance to the community and the society. In Japanese term, they talk about ikigai. I don't know how to pronounce that word, but all of you are supposed to find your own ikigai. What is that? Is you have to find a job that you love. You have to be good at doing that. No point you loving to do thyroidectomy, but you are a very bad surgeon. So you have to be good at it. There must be a need for it, and you should be paid for it. If you can find your love for the job profession, and if you're trying to be good at it, something there is a need for it, and if you're being paid adequately, then you have found your need and you have found your happiness. If you concentrate more on getting paid than loving the job, being satisfied with the job, then there may not be happiness. So you have to balance all these four. Whether you find it in Sri Lanka or whether you find it in UK, Australia doesn't actually matter as long as you find it. Thank you.